live in 5, 4, 3, 2, 1.
Well, good afternoon. I'd like to welcome everyone to the McCreary County Board of Health annual meeting, this being Tuesday, February the 8th, 2022. And at this time, I would like to declare the meeting in session. We will start with approval of the minutes of our last meeting. Everyone should have gotten a copy of that sent to them via email. Are there any questions? Can I have a waiver of reading at this time? And so vote on them. Have a motion to waive the reading of the minutes. Second?
I'll second that motion.
All in favor, aye? All right. Minutes will be approved as sent out via email. At this time, we'll move to old business. Do we have any old business that we need to discuss? As I look through this, the only thing that I saw was the report we were supposed to get on the trail from the money that we gave them. I think Judge Green was going to check on that and get back with us, and I don't think I ever heard anything on that. That was the only old business that I saw.
Okay, I didn't know if Nathan had got back with you. I'm not sure exactly about the money wise, but down there at the reservoir, they built a dock. We've got a bridge put in. They've done a lot of improvements. It's really nice to get a chance to go down there and look at it. And actually, it's going to be open, according to Stephen Whitaker, the water district. It's going to actually be swimming allowed. So I haven't seen any new signs on that, but there's a lot of improvements. If you get a chance, go down there and look. So whatever money was given, I know a lot of that was done. I think originally it was for some canoes or something, wasn't it?
I think so, yes.
Okay, so I'm not sure that was before. That's before I came into office, so I'm not sure exactly whatever happened with that idea. So is that what you're looking for?
Yeah, I think, that just shows improvements. Money went to a good cause. I think It will be great for the community, health-wise and other, recreational as well. So I appreciate that report on the old business. Does anyone else have any old business to bring forth? If not, we'll move on to new business. And the first thing on the agenda is the electing of new district officers.
Mr. Chair, I believe the current officers are yourself as chair, Dr. Steve McKinley as vice chair, and then Sean Crabtree served as a non-voting secretary. So if you elect that position, you're able to do that locally if you want a local person to serve, or if you prefer, I'm willing to serve in that role. The benefit of having the director in that type of a role is that that gives me or that person authority to do business on behalf of the district. So I would be able to sign things and do some business for you all that would save some legwork from us having to track people down for signatures and things just under routine business circumstances.
I think we would all be in favor of that. I don't think there will be any question. So I guess at this time, the floor will be open to nominations for chairman of the board. That look like a good chairman.
I would like to know.
I'm sorry. Amy. Oh, Amy. I didn't know what you was asking.
All right.
I'm deaf. I got hearing aids ordered.
So I would like to make the motion that we nominate Amy as discussed.
Secretary.
I second that.
I'll second it. I don't know that I can as chairman, but I will. All in favor, say aye. Aye. Motion carries. Now we'll go on with the chairman of the board. Floor is open for nominations.
I nominate Terry. Can you serve again?
I can for another year, yes.
Oh, I would like to nominate Terry Lawson as the chairman.
I have a motion and a second. Any other nominees? If
Who
not,
was the second?
all in favor, say aye. I'm sorry, go ahead, Amy.
I said, who was the second, sir? I didn't hear that, just for the record.
Martha Johnson.
Martha Johnson.
Thank you.
All righty. Okay, all in favor, say aye.
Aye.
Now we need to elect a second in command, vice chair. Floor is open for nominations.
Currently, Dr. McKinley.
I've not seen him probably in 3 or 4 weeks.
He's supposed to be on there.
I'm
He
here.
is.
Oh, there you are, hiding from us. Turn your camera on, my dear friend.
I can't get it to
Are
work.
you- yeah, you're about a high-tech redneck as I am, okay.
Come up with us. Yeah, he can come over here.
Are you willing to serve as vice chair again?
Yeah.
Okay. Anyone else want that position? If not, I'll entertain a motion. I need a motion and a second.
So moved.
Grady makes the mo, and who second?
Second, Judge Green.
Judge Green seconds. All in favor, say aye.
Aye.
Being no opposed, we will consider that to be finished. And that brings us to June 30th, 2021 financials.
Hey, Amy, is anybody's terms expiring?
They are. We have 2, 3, 4, 5 members who have terms expiring this year. Kim, do you have that in front of you? Do you want to talk about that, or do you want me to?
I do. It's, let's see, Azalee Agnew, Jennifer West, Rita Wright, Rosalie, and Dr. McKinley. So, do you all want to stay on the board another year?
Well, see, considering Dr. McKinley just took the vice chair, I think he's in.
This would be for a 2-year term, so it would be 2 years.
Okay, from me.
Okay.
Rita Wright is out of town. She couldn't be with us today, so I'll have to get with her and see what she wishes to do.
I think she probably will, but if not, we can fill that later, I guess. Okay.
So that will
All right,
actually be an online process. Kim will help you all get the information she needs and get that submitted closer to the end of the year, but we just wanted to go ahead and get that taken care of. I don't think we mentioned either at the beginning of this meeting, but we do have a quorum present. We didn't do an official roll call, but there is definitely a quorum of members here, so the meeting is official.
Okay, financials, I guess is where we are.
Yes, sir.
Are you going to do that?
Ron, I'm going to let Ron speak to that. He's got the local information there in front of him. I'm actually traveling today and out of the office and out of pocket, but I have the information in front of me. But I think Ron's a little more familiar, so he's going to do your financial presentation.
Yes, thank you, Amy.
All right.
I'm gonna share my screen here if I can find it. There we go. Okay, can everybody see my screen?
Yes, sir.
Okay. So in prior years, even prior to when I started here about 4 years ago, we normally sent out your prior year-end financials via email or via regular mail to each of the board members. We did that all the way up until last year. Well, because sometimes we get audits and everything anyway, and it gets delayed. I started seeing it was kind of pointless to send the financials so close to the board meeting and not just include them in the packet and kind of kill 2 birds with 1 stone. So that if y'all had any questions, you could say it on the meeting or ask me in that way. So this is the first year, and I'm going to start incorporating this every year and just doing a quick presentation, not in great depth, of the financials, because if you want to get in more depth, like I said, you can look at the financials I sent you. They give you a pretty detailed picture of what went on. last year. So as of June 30, 2021, year end, you began that year with cash on hand of $526,634. And I won't go through each of these, but you of course had your normal breakdown of real estate tax receipts, tangible taxes, motor vehicle taxes, delinquent taxes, other taxes, and some interest income from your checking and CD accounts. And you had total receipts as of June 30, 2021 of $233,044, giving you total cash available for the year of $759,678 before any expenditures were spent. You spent a total of $212,001, comprised of all the normal costs. There's really nothing different here that we don't normally do between all the categories you can see here: advertising, maintenance, the rent and leases, very small, just I think it's a PO. The district management, materials, supplies, dues, grants and donations, miscellaneous. We had the big building improvements this past year where we did all the building construction, furniture and fixtures and equipment for that total, leaving you a cash on hand at the end of the year of $547,677. Moving on to the balance sheet, that basically just reflects what I just told you in cash, but it gives you a little breakdown between cash and CDs. I'll let y'all look through that on your own time there to kind of see how that's broken down, showing our total cash balance as of June 30 between the CDs and checking. Okay, and then this is probably one you're a little more interested in. This one, if you'll see at the bottom, it references this references the total receipts I just went over with you, and the total expense, showing that you guys actually had a surplus last year of $21,043, even though we had budgeted a deficit of $18,947. Now, like every year, and I'm explaining this when I get to the budget presentation, a lot of the items we budget, or a chunk of the items we budget, are miscellaneous costs. Like, we might budget miscellaneous maintenance and repair, miscellaneous furniture, miscellaneous equipment, because we really don't know sometimes what things are going to come up. We could have a bunch of laptops go out, or printers, or roof issues, or HVAC units go out. And when those things come to fruition all in a year, when it rains, it pours, you probably have a better chance of being in a deficit position, or in a break-even position. But in a year where, those expenditures are retained, that obviously goes back into our funds. So that's what happened this as of June 30, 2021. So I'm not gonna go through those. I just went through those on the revenues and expenditure. All that is the same thing I just went over you. But this sheet is actually a profit and loss versus budget. So it shows you by category. I just want to explain it to you so when y'all look at it, you'll understand. By category, each category that went over under budget. And as you can see, on every expense category, we were either at break even or above budget. And except for on three of the categories, on two of the categories, we were under budget on revenues, but the other categories we were actually over budget. So once again, did very well in comparison to budget. So finished with a $21,043 surplus. That's all I have on the financial presentation. If y'all have any questions, I believe that's it.
Questions from anyone? Comments? Do we have to have a vote on the acceptance of that?
I don't believe so. I think we just adopt the tax rate and the budget. That's the only things that require a vote, sir.
Yes, and if you had it, just so you know, and if you had an audit, you would have to do it. But this year, y'all did not have an audit. But I do believe, if I recall, you're going to have one next year. But this year, you don't have to prove an audit or anything.
Okay, then I guess the next thing on the agenda is to set the tax rate.
Okay. I think Ron's going to talk to this also, and we usually do this as a tag team with the budget and present the budget and then show you the options for what your tax rate may want to be. Ron, do you want to elaborate on that?
Yes, absolutely. Just to kind of, just to add to what Amy said, we always tried to include the rates as a presentation inside the budget. because obviously it's hard to pick a rate without seeing how the rate's going to affect your budget at the end of the year, or for next year. So if you remember, we do that in 3 categories, which I'll get to in a second. Between current, showing what your current rate is, your break even rate would be, and your surplus rate would be. Of course, the last mini chunk of years, y'all stated y'all's current rate, but we'll get to that in a second. So what I'll do is I'll present this budget pretty quickly, and then before we approve the budget, obviously you'll go back and actually approve the rate first, and then we'll come back and approve the budget. So starting here at the top of this budget, you had a balance as of December 31st, 2021 in your cash account of $234,213. For all 5 of your CDs, totaled $372,873, giving you a total balance of cash balance of $607,086. We projected, based on the remaining receipts that we had budgeted between real estate, motor vehicle, and tangible taxes, that you're going to receive another $87,099 roughly by the end of June 30, 2022. With a combined interest between checking and CDs, additional of $2,173, giving you a total of $89,271 we plan that you will receive in receipts by the end of June 30, 2022. Giving you a total funds available before expenditures of $696,358. We are projecting your remaining 2021-22 expenditures to be a variation of categories as usual. The $81,458 that will come to fruition. This is the second half of the fee owed to be a part of the for the 2.8 cents to be a part of the Lake Cumberland District Health Department that y'all pay every year. We already paid the first half back to the district in December, and the second half will go back roughly in May, maybe early June. So that definitely will take place. We didn't have any more grant spending planned for the rest of the year, nor did we have audit costs planned for the rest of the year, but we do plan on spending another $290 in advertising. Do remember that my maintenance and repair, my furniture and fixtures, and my equipment, you're going to see that these are big costs left to expend. Remember, it's what we budgeted less what we spent already, and a lot of these may not be spent because I'm factoring in miscellaneous costs and everything else. So assuming you don't run into some really bad problems, more than likely you will not spend all the remaining $19,651 in maintenance and repair. So more than likely that won't happen, but I'm presenting it as worst case here. So $19,651 left in maintenance and repair. You will spend the dues and subscriptions. You have $1,215 left to pay to KPHA and Calbo and SPGE. You probably won't spend this, but we always leave it in there because there's other miscellaneous costs that could come up. But normally this board expense, if y'all remember, is what we pay for meals for the board meetings. Obviously you guys, I'm guessing that there's probably something provided today, so that'll cut into that. But normally it's a higher cost when everybody's able to get together and do our actual face-to-face board meetings, which hopefully we'll get back to at some point in the future. So that's what that's for. And then the $9,975 in furniture and fixtures left to spend, and $21,382 in equipment. Giving you a total remaining expenditures to expense by June 30, 2022 of $134,471. Which would leave you with an estimated opening cash balance between CD and checking of $561,886. Now, getting into the budget, the only category I'm going to present to you is this middle column right here that says proposed budget at current rate of 4 cents. Okay. I am going to quickly show you at the end the 2 other categories, but my budget presentation here is going to be using this category. We are projecting for your receipts for 2022-23 budget year to have real estate taxes of $172,828, tangible property taxes of $24,175, motor vehicle tax of $28,708. We got those numbers, and most of you know this, but for those who don't, from the state, who got it from the Office of Property Valuation. the sheets for the 2021 tax year for the local governments. And this, of course, is your county shown here below. We use those numbers and plug them into our calculation right here on this page, showing how much receipts, projecting you're at a 4-cent rate here, if you see all the highlighted numbers here. And then showing the fee, of course, you got to pay back to the district, and then showing that you receive these rates at a 95% collection rate. We just use 95% because we always figure there's a little wiggle room for no collection on some of these fees. And that's where we come up with each of those category numbers. Moving on to delinquent tax collections. This one's the hardest one to estimate because it doesn't matter the county. Each county is different. Sometimes we receive anywhere from 5 to 10,000. Sometimes we receive just a couple thousand each year in delinquent tax collections. So it's really hard to estimate. So normally I base it on prior year, and based on where you're currently estimated to be at, I'm projecting you'll receive 7,000 in delinquent tax. And this is your normal telecommunications tax. These are roughly the same every year. They go up a little here and there. You're projecting you'll receive 1,500 in telecommunications. And then, of course, interest income between checking and CD, projecting you'll receive $2,227 based on your current balances and projected balances. That would leave you with total funds available before we get into your budget expenditures of $798,325. Once again, as we get into your budget expenditures, you have your district fee to be part of the district of 2.8 cents of 166,314. That's the annual fee to be part of the district. And then some of these are normal categories. We normally have maintenance every year and snow removal. So I got you there on for maintenance at $2,000, your snow removal at $1,000. These are some other categories that were Kim had put together for us that we're saying were needed for the building. Some painting being done of $2,900. Some repairs to the sidewalk where we have to add a drain for $500. Construct a storage closet there in the building of $3,300. Barriers to help to keep vehicles where we have vehicles that keep getting on the lawn. So barriers for $1,500. And a new tin roof for the building that's outside the health department there of $3,000. Those are the newer ones. Now, once again, we normally budget miscellaneous cost. I think I raised it a little bit this year to 16. The cost of HVAC replacements and things are going up. So normally I like to budget for at least 2 HVAC units just in case a couple go out. So we don't have to have a special call board meeting to approve anything. This should cover 2 units for the most part. Most everybody you talk to says every HVAC unit that's normal will range anywhere from about $6,500 to $8,000 based on my last talks with some of these guys. So that's why we have that in there, and anything else that can come up for the building. That would leave you a total building maintenance and repair cost of $30,200. We have furniture and fixtures. This is our normal seasonal and updated decor in case anything kind of needs to be touched up with the building, and nice little decorations for the building to make the building look nice and presentable. $1,000. They wanted some toys and books budget this year of $300 for some of the patients and people with the building. And the miscellaneous cost in case we have broken chairs, broken furniture, whatever, to replace that for $5,000. Total budget of furniture and fixtures is $6,300. And equipment. If y'all remember, y'all have the automatic generator that helps us if the building goes down, to help save our medical fridges and things like that, so we don't lose a bunch of our vaccines and medicines and everything. For $500, that's an annual maintenance that they do to come top off the fluids and check to make sure it's working properly. The guys who installed it. We have miscellaneous computers and related equipment. The reason we have 2 categories. This first one for miscellaneous computers and related equipment is just computer related stuff. So printers, faxes, scanners, laptops, desktops, things like that. That's obviously a bigger cost normally, and that's one that has more damage and repairs normally. So that's much higher. The miscellaneous category here would be if we bought a miscellaneous, if we bought a piece of equipment that's not computer related, like something for the nurses, like a piece of medical equipment, like a stethoscope, or just different things, or a medical fridge or something like that. It'd be other types of equipment that we would have to buy. We budget a little miscellaneous in there, $5,000 for that too, giving you total equipment of $15,500. And then, as I said before, you will have an audit next year. It's required every 4 years, and y'all are coming up 2022. And after next year, you won't have another one until 2026. So that audit cost normally is around $1,400 and some, but just in case they go up, we budgeted $1,500 for the audit next year. And then advertising and printing cost, budget $300. That's pretty normal. We budget every year. Dues and subscriptions, we normally stay a part of these organizations. CalBO for local boards of health. We are required to contribute to the SPGE and the KPHA for $1,500. And then miscellaneous board meetings, once again, this is for food and everything, of $500. Giving us total budget expenditures for budget year 22-23 of $222,114. That would leave us with a cash balance between CD and checking of $576,211 before any optional expenses, and a net surplus based on your current tax rate of $14,325. There is an optional expense that Kim asked me to put in there, and if y'all need her to elaborate, you can ask her to do that. But this for a hands building expansion of $10,000. And that would leave you with total expenditures being $232,114, and the balance, including optional expenses for our cash, of $566,211, which then would make your net surplus a $4,325, almost being break even there. I'm not going to go through the categories again, but your break even, it does show your break even rate would be 0.0392. If you chose to have a surplus, which doesn't look like you need to have that, but that's completely up to you guys, of 0.042. And that is the budget as presented. We will now need to go back to the tax rate.
One quick question, with runaway inflation, how sure are you of this budget? Is this pretty rock solid, or could we see this thing change quite a bit?
You mean as in your costs going up? Is that what you're asking?
Yes.
Well, you guys are, I think you guys are perfectly fine. With the rate you're at, I think you're more than sufficient, even if you had a horrible year. I think it was proven last year that you ended with a surplus. And once again, that you didn't have some really bad things happen in the building. But even with a building project done last year of $34,000, you still ended with a surplus. So you have plenty of cushion in case the building falls through at your current rate. And yes, even with inflation, I think you're just fine where you're at.
And I think that on the normal expenses too, that you did kind of build in a little bit of a pad there too, Ron. I told, you and I talked about, you increased the cost like for snow removal and salt and some of those things that we've already seen has increased. So I think that the budget is fairly solid, Tank.
All right. So, everyone having seen the presentation, do we have a motion for setting the tax rate at this time?
I make a motion that we keep the tax rate the same as it is now.
Have a motion to keep it the same. Do I have a second?
I second.
Have a second. Any comments? If there's no comment, we'll take a vote. We're voting on keeping the tax rate the same as last year. All in favor, say aye.
Aye.
Any opposed? All right. We will leave it the same, my good man.
Okay, now we'll have approval of the budget, and when you approve whatever you guys decide to approve, you will need to make a motion to include or not include the optional expense for the hands building expansion. And like I said, if y'all have questions about the building expansion, you can direct those to Kim.
You want to just address the...
Yeah,
it was really more of a storage issue. This building is large, but we just don't have a lot of storage. And now with all of the extra, we have so many incentives for these programs, we don't have anywhere to put anything. So our hand staff is in a small room. Of course, with COVID, they were all in there kind of close together anyway. So it was brought to my attention. I had systems design came in and did a little thing about a potential hands expansion a couple of years back. But they thought about just doing this and making the little area where they are now a storage room. So that would give us extra storage, plus it would widen the area for them. That way they wouldn't be on top of each other. But that was just something we were looking at. It's just a ballpark figure for storage, basically. Added storage in the building is what we need.
Thank you. Don't know that anybody out there in TV land can see this, but I'm gonna hold it up just to show you what she just showed us. All right. Sounds reasonable to me. I will leave it to the floor. Do we have any motion to proceed with the building? Disagree with it?
I'll make the motion to approve the hand expansion.
I have a motion to approve the 10,000 for the Hands Building expansion. I will need a second.
I second.
Okay. We have a motion and a second. Is there any discussion at this time before we vote? All right, if not, we'll take a vote. All in favor, say aye.
Aye.
Any opposed? All right. So the 10,000 is in the budget, sir.
Okay, and Amy, I think we will need just a main budget approval now, correct?
Yes, I think we just need one final vote. Since the vote was just specifically on that line item, we will need a broader motion to accept the budget with the $10,000 inclusion.
Okay, I will put that motion on the floor that we accept the budget as you're seeing it, including the $10,000. I'll need a motion and a second on that.
I motion, accept it.
Got a motion? Do I have a second?
Second.
I have a second. Any comments before we vote? Discussion? If not, all in favor say aye.
Aye.
Motion carries. All right. Does that take care of all that business that we need to talk about now? We can move on. Is that correct?
I believe so. I think all your business is out of the way.
All right. The floor is yours, Amy.
Thank you, sir. I just want to do a quick introduction. For those of you that don't know me, my name is Amy Tomlinson. I was appointed the director of the health department. Actually, I think it was the middle of June last year. Mr. Crabtree, who you all are very well familiar with, retired at the end of July. So the district board appointed me in June and allowed us about a 6-week transition period where we worked together, and he trained me, and I got to do a lot of the same things alongside of him and learn from him before he left. So my first official day as solo director was August the 1st. That was around the time of Delta variant starting up and all that fun stuff. And then we got through that. And then, of course, right around Christmas, Omicron has hit. So it's been COVID nonstop for me from day one as far as the director role. And while I say I started in June as the director, I've actually been with the health department for 17 years. So I'm not new to the health department. I recognize many of your faces, and you probably recognize mine. I'm just new to this particular role. I have a master's degree in public health from Western Kentucky University, and I'm very anxious and excited to have this opportunity to serve my community in this way. So I want to give you all just a very brief COVID update. You all are well aware that it's still here. We deal with it daily. I know all of you healthcare providers are tired of it and worn out with it, just like all of us are. As far as the health department goes, across our district, our 10 counties, and like I said, I was traveling today and I failed to grab the McCreary County specific data, but I can make this available to you all if you're interested. I looked across the district at our numbers, and we have administered anywhere between 35 and 36,000 doses of COVID vaccine since the time the vaccine became available. I don't remember off the top of my head what McCreary County's share of that would be, but it would be substantial since medical providers are generally limited in that county. So it's a huge amount of work that has gone on at the health department, and I cannot say enough good things about the staff locally, how much they have pitched in and done, all the hats they've worn, all the different roles they've taken on during this, above and beyond their normal job descriptions. It's been truly a team effort across the district, and I'm just so proud of my staff. As far as the current situation for COVID, We are actually starting to see a decline in cases finally after this latest surge. The state reported a decline a couple of weeks ago. I think they first started talking maybe the first of last week. And typically in rural Kentucky, we follow a week or two behind what the state is seeing. So usually takes a little while longer to trickle down here to us. So I looked at our numbers last night when I did our weekly summary. For McCreary County last week, the state reported 180 cases and 1 death for McCreary County as far as due to COVID. That was from January 30th through February the 5th reporting. At that same time period for the district, it was 2,060 cases and 14 deaths. So it still seems high, but compared to where we have been and where we are going, it's going down. Now, our local numbers, we had been reporting locally the specific numbers for our counties just up until, I guess, the end of January. Just recently have we stopped, and we're reporting the state numbers now. And that's been a big transition, a big difference for us, and a lot of people are not necessarily happy with that at the local level, and I do apologize for that. But with the surge that we've had, we have not been able to process cases quickly and timely. So we had to go with state numbers. So that's what we're sharing. The state has the electronic reporting capability, so when things get reported from labs, they go directly to the state. Initially, when COVID started, some of that wasn't set up. And so I had spent a lot of time, and Mr. Crabtree had spent a lot of time instructing people, decision makers locally, to use our local numbers because they were more real-time data. It was more boots on the ground. It was much more relevant to what we were truly seeing on the ground. And now with this latest surge, we just have not been able to keep up. And the state has also improved their processes as far as reporting over the course of the past 2 years with the pandemic. It's much more electronic now. They've sped up their processes. So the state numbers are truly more in line with what we're seeing at this time. So that's where we're kind of steering people toward. That's the reasoning behind that. And the backlog of cases that we have at the health department, you can imagine, started with Omicron around the holidays. I think you all mentioned, I heard some of you talking beforehand that some of you all have even experienced it personally, the illness with this latest round. So between the holidays, with the snow days that we've had in January and February, and some closures for providers for the health departments, all this, Martin Luther King Jr. holiday, some of those things, we have just fallen behind. We just cannot keep up with the daily cases. So the health department has prioritized our approach, and what we're doing now is every day we print off the cases, we look at what we've got, and we try to prioritize those in the highest risk groups. And this is all through guidance with the state health department. So we're following right along in line with what other health departments are being told to focus on and do, because we can't do everything anymore. So what we're doing is looking at congregate settings, people that are in groups of high risk populations, or people that are spending long periods of time together, such as school settings, daycares, nursing homes, homeless shelters, where they may be in a high-risk group, age group, target group, that kind of thing. And that's what we're focusing on as far as case and contact investigation. We're looking at it truly as outbreak investigation at this point. So instead of contact tracing every single case that comes in, it is much less effective at this point of the pandemic, with it being as widespread as it is, to try to trace where everyone has been when the disease is also everywhere. So we're focusing our efforts on those groups that may need additional support, may need additional help with guidance, with decision making, whatever that may be. So that's where we're at as far as the health department goes. We do that daily, but as you can probably guess, we're getting 600-700 cases sometimes a day into the health department, and we're not able to contact all of those. So the ones that we reach, they have been being reported, and then the ones that we didn't reach, we just put to the side, and we were counting that as a backlog of cases, because generally, also around the first of the year, the quarantine guidance changed. So it went from being 10 days of quarantine and isolation down to 5 days. So a lot of times, by the time we receive a positive lab or a positive result at the health department, and we reach that person doing a contact investigation, it's approaching or already past their 5 days, because they may have had symptoms a day or two before they went and got tested. Then they went and got tested. Then it took a day or two for us to get that result and get it worked. So it was already approaching their 5-day period. So that's another reason that our local numbers are not representative and kind of skewed. So for instance, yesterday on our case log, we processed 1,403 cases. The majority of those cases, however, were probably from January, from the backlog that we're being able to process now. And so the state has a system in place that pulls those numbers out, and they only look at truly cases that were lab reported within the last 7 days for their incidence rates. Whereas I didn't have a way to quickly and easily decipher that. So when we reported 1,400 cases, that looked very skewed, and it skewed our data considerably because it looked like those were real-time cases, even though we knew they were backlog cases. So having said all that, that's why we're now pushing towards state data reporting, trying to be more standardized and more uniform across the board. It's just unreal. Whoever in the world would have thought that, in the beginning of 2020, when all of this started, that we would still be here at this point in time. And it's just a lot. But besides all of COVID, of course, there are normal things going on at the health department. The normal job continues on and doesn't stop just because of the virus. So we're still continuing to do WIC, diabetes, health education. Tiffany's going to talk in a minute, I know, about some of her things, but they're back in schools. They're doing some programs and classes in the communities. They're doing their coalitions again out in the counties, trying to build the partnerships and get information out in education. We're also going through reaccreditation at the health department, which is a huge endeavor. We went through initial accreditation for the agency 5 years ago, and it was a 5-year period. So we are now due for reaccreditation. So that is involving a lot of our department heads and a lot of decision makers across the board getting involved with looking for documentation and verifying processes and reviewing policies and all those types of things. So we're extremely busy at the health department with a lot of different things. We're all looking forward to the day when COVID is behind us and we can focus our efforts a little more on, moving forward and getting past this. So I will be happy to entertain any questions from you all if there's anything that we can do. If you all have concerns locally of ways that we can partner better or serve our community better, I'm certainly open to those. And you all can contact me anytime with that.
Let me back up a little bit to COVID. Now, this is probably more pertinent to me in my office than it is to the board, so I'll try to be quick and not take up everybody's time.
Okay.
Back to reporting. It got pushed over to us now. Any way that to shortcut and get into Key High? Because we can't get there. We tried this about 4 or 5 years ago with Key High when we were reporting vaccination for children. It didn't work then, and it's not working now. And they're getting ready to impose a $1,000 a day penalty on us if we can't get into the reporting system.
Oh, goodness.
So we applied online. They tell you they'll send you back a link. Well, the link never comes. And right now, Emily has taken on the duty of doing a hand form of all of our January, and we're going to try to mail it to somebody or do something with it. But, speaking of not reporting, there's a month's worth sitting in our office.
Okay.
Let me, Colby has emailed to see if we can just, there is in the email that Sam sent out the middle of January, that had the new updated information. You don't have to do a PUI form now on lab reported cases, but,
right.
Rapid cases obviously need to be reported. So negative and positive. Well, we had no way to report those because we can't get into KHI at all. So we've emailed, I know once, if not twice, to see if we could just fill out the form because there was a physical form in the email if you didn't have access. Well, but there's no indication of where to send that to. So
Okay.
I emailed at least once or twice to see, can we just fill that form out until we get access, and send that where to email that form to. Well, I know I've got hundreds of tests that need to be negatives. All of our positives, we've still PUI'd all of those positives, rapids, and so that those are all being taken care of. But I'm talking negatives that still need to be reported because, they're tests that we've done, but we have no way of doing so. But anyway, on their website, it takes 30 days if you want to onboard and it go directly when you enter it into the system, it directly upload itself. Well, we don't have time for that because that's a month and a half worth of testing. And I sure don't have time to enter all that. But to get access to their portal, it was supposed to have been a 3-day thing. Well, I'm almost 2 weeks in now and still don't have access, and 2 weeks worth of more testing.
Okay. I want to say that I saw guidance somewhere that negatives are no longer required to be reported, but I may be speaking
Well, on
totally
that,
out.
unless it's a new email that I've not seen, that email said all tests had to be reported.
Okay, let me double check that then and make sure. And what I need to do is probably speak to you all offline about this and get some information on who you've spoken to or what email you've got or whatever, and try to follow up with it on my end. I'll try to figure out who at the state we need to get a hold of, and if it needs to be a conference call where we, light a fire under somebody or whatever. I'll certainly try to help you all. Seems like I remember this, Tank, with this issue back at the beginning of COVID. I remember you saying you had issues. So this has been a 2-year-long process for you all?
Exactly.
Wow.
Well,
Okay.
it would have been a convenience thing 2 years ago. It's a mandatory thing now.
Okay.
And again, we talked about this offline. I don't want to take up the time for the health department. I just wanted to grab your ear while I had the chance.
Okay. I'm certainly willing to help you all. Let's talk offline. If you all want to, Kim can set us up a conference call or something and we can discuss together, or we can set up a private Zoom with your practice, whoever needs to be involved, and I'll help you all any way I can.
Thank you.
You're welcome.
Thank you very much.
Anybody else have questions or comments for me?
Okay, according to my agenda, Ms. Baker is next on the agenda.
Yes, so thank you all for having me. My name is Tiffany Baker, and this is my second year speaking to you, so I just want to thank you all for this opportunity. So in your packet this year, you've got a 3-page data sheet from health education, and it looks a little bit differently than it typically does. So your first 2 pages is more of a data as a point in time, rather than comparing recent years like we typically do. And what you're going to notice if you do look back, like on the 3rd sheet, for instance, those data points, they look a little worse than they did last year. I'm just going to be honest with you, but they're still overall pretty good compared to where we have been before. And I think a lot of those changes, of course, can be related to COVID. I hate to blame everything on COVID because it sounds like that's all we do, but we all know that there's a big impact on how COVID affects just the health in general, whether it is, of course, getting COVID or the mental aspects along with it too. And so I think that a lot of those changes that we're seeing is going to be related to that stress. And so it's going to be interesting seeing that as we move forward. As far as the 2nd page goes, you're going to see your priority health issues there in the center. And those were compiled through the MAP process that our coalition did. Now, this occurred before I got hired on, but those 4 topics, of course, are substance use, tobacco use, obesity, and teen pregnancy. And so those are things that through some various assessments and data that the coalition collected, they realized that these are the things that matter most in McCreary County, and that's what we want to focus on. Those 6 circles below that, those are things that either relate to those or things that health education does take an interest in. So for instance, like the teen birth rate, there's several programs that health education does, and we help teach some of that abstinence-based sexual education in schools. And so that's something that we've been able to do this year virtually at both the middle school and the high school. So we're very grateful for that partnership. The drug overdose deaths, you'll see there, there's not data there. And the reason for that is the data in McCreary County is suppressed. The number was so low, but we also know that sometimes the drug overdose data gets a little wonky here. So that's just the reason that that shows NA. So as I said, we are still having our coalition meetings. Those occur every month, and we're doing a lot of Zoom right now. Our coalition is very unique in that we have a 3-in-1. So we have Kentucky ASAP, we have our health coalition, and we have Operation Unite. We all meet on the 4th Tuesday. If it's Zoom, it's at 10 a.m. Eastern. And so you all are more than welcome. Our next meeting is the 22nd. And then as far as our community programs, as Amy said, we are doing those once again. They're virtually completed, so that's going to be with the schools. We also have the opportunity for smoking cessation classes. We weren't able to do the one in the spring or the winter spring like we were hoping to, just because we didn't have enough individuals in the communities that wanted to or that had signed up at that point. But one good thing we do have in McCreary County that I'm very proud of, we have free nicotine replacement through our Kentucky ASAP. We have that partnership that allows McCreary Countyans who are ready to quit smoking and joining those classes, they have a means for cessation that was just really beneficial, and it's free of charge to them. Some additional funding opportunities that we have received as health education. We still do have that $25,000 grant that I mentioned last year to work on tobacco control. And so that's the Clearing the Air, which for those of you who are with us in the office, that's the mask and the pins that you all have out on the desk. And then for any of you who couldn't join here that or able to get it set up elsewhere, I have plenty. So if you want to stop by, I can give you a mask and a pin too. And then I already talked a little bit about the coalition. The last two things I wanted to mention, as Amy's talked about with the reaccreditation and things like that, we're also updating our community health assessment or our CHA, and we are adding an addendum to that. And so that's going to have the most updated data available, the health data, and that's going to be posted on our website on February 21st. And then the last thing we're going to work on is the community health improvement plan. That is upcoming too. We had actually received a $10,000 grant additionally to work on that. But then COVID wound back up, and so we have put that on pause. But we are going to be working on that and hoping to get that completed in March. So I think that's all I had I needed to tell you all. But if you have any questions, I'd be happy to answer or try to.
Anyone have any questions for Ms. Baker? If not, thank you for the report. Keep up the good work. And I guess, do we have a specific topic on diabetes, or is that just what she just covered?
There was I'm not sure if Vicky's going to talk to us, but there was a presentation that they put in the packet.
Yeah, it is. Not every diabetes coordinator is going to be able to make it to each board meeting this year, but they were going to present when they could, but I don't think they made it today. But it is the last couple pages in your packet there for reference. If you have questions, you can get with either me, Amy. We can direct those to Jamie Lee, who's over that at the district.
Okay. Well, that ends my agenda. Is there anything else from the floor that needs to be discussed or talked about?
Yes, I just wanted to make a comment. I just think the health department's done a great job over the past year, over the past 2 years. I know working at the library, Kim was able to get basically my whole staff, those who wanted it, boosters on the same day. So she had us come in like every couple hours, and we got it all taken care of, and I just can't say enough nice things, and we really appreciate all the hard work, great work you're all doing here.
Hear, hear. Any other comments from anyone?
I will say this, it just came to my mind when he made that comment. Thank you for the kindness. We definitely appreciate the kind words, because so often we get chewed out, as many of you all do, along with these lines. I think we are getting ready to celebrate this year, and I have to look into this because someone just planted this in my ear a couple days ago. I think we are getting ready to celebrate 40 years as a district, a 10-county district. So I think that's coming up this year, probably July 1, I would guess, but I need to look into that. But if that's true, and if my research pans out and that's true, I may come back with you all, and we may try to do, especially if COVID goes down, we may try to do some sort of a thank you or an appreciation or something for staff at our local sites, and invite you all in, then to come by and say hello to us.
Sounds like a good idea to me. Mm-hmm. Anything else from anyone? If not, I'll entertain a motion to dismiss.
Motion to adjourn.
We have several motions. Does not require a second to dismiss. So thank you, everyone. We'll see you next time.
Thanks, everybody.
See ya.